You're the ICU doctor on call. It's 2 a.m. and the nurse calls you because an ECMO patient is now showing signs of hypoxia, but only on the right side. This patient is a 47-year-old gentleman who presented with hypertension, obesity, and STEMI. The STEMI was stented with the LED through a PCI, but unfortunately he had refractory cardiogenic shock. Despite multiple vasopressors and inotropic support, he needed an intra-aortic balloon pump. Despite this, his lactate continued to rise and he had worsening shock state. Ultimately, it was decided to put him on a FEMFEM-VA ECMO. This was initiated about 24 to 36 hours ago. This was done quite well. His EF at that time was around 10 to 15%, and he was on multiple vasopressors at the time, including dobutamine, epinephrine, norepi, and vaso. Now, the ECMO was initiated. At that time, his lactate was actually around 20. He had significant multi-organ failure. But over the next 24 hours after ECMO initiation, his perfusion improved quite a bit. His organ function improved quite a bit. He had decent urine outputs. Luckily, he didn't even start CRRT. And his lactate went down from 20 all the way down to 5. It still wasn't normalizing, but it was going in the right direction. His PaO2s were actually fairly normal with pH, had good oxygenation with PaO2 greater than 200s on minimal ventilatory settings. However, this is day 2, and now the nurse is calling you at night and saying the right radial PaO2 is actually quite low. And I'll post what some of the other findings are here. Take a look. Why is the right-sided ABG so hypoxic and not the left side? What's actually happening in this patient's physiology, and how do you fix this?